I am delighted that the Indian Society of Blood Transfusion and Immunohaematology is celebrating the Golden Jubilee year and holding the 50th National Annual Conference this year in September. Indian Society of Blood Transfusion and Immunohaematology was established in 1972 by late Professor J.G. Jolly and late Mrs. Padma Shri Mrs. Kanta Surukrishan, along with a group of national activists for improving the blood transfusion services of the country. The main aim of the Indian Society of Blood Transfusion and Immunohaematology was to have safe blood and a quality blood for all patients. And accordingly, the society started to set up the state chapters and its convenience. I joined ISBTI in 1978 while I was doing my postgraduate diploma at PGI Chandigarh, and then after passing my MD in pathology at PGI Chandigarh, I returned back to the state of J&K, where I set up the Department of Transfusion Medicine, and along with also formed the state chapter of the ISBTI. It was my passion for the blood transfusion services that the blood transfusion services of the state got slightly improved, and also I got involved in the National Blood Program at DGHS, and we started framing some guidelines for the voluntary blood donation as well as the quality standards in the blood transfusion services. In 1986, I became the Vice President of the Indian Society of Blood Transfusions, because the main focus at that time was to ensure that we promote the voluntary blood program in the country. In 2001, I became the Secretary General of the ISBTI and worked almost a decade as the Secretary General, and during this time we launched a lot of movement for the promotion of the voluntary blood program. We launched a program called Rakta Kranti, the Red Revolution in the country, and started celebrating both the national as well as the World Blood Donor Days under the aegis of the ISBTI to promote the voluntary blood donation. I wish the ISBTI great success in its endeavors to meet its mission and the vision. Good luck.